Compassionate, confident, caring. These are just a few of the words that our patients and physicians have used to describe Mount Carmel nurses. Every day, you exhibit excellence in nursing. You are on the front line of patient care. Our patients remember the moment you took the time to make them feel as comfortable as possible, or help them forget just for a second that they were in the hospital. Not only do you take care of your patients, you inspire them. Look how you inspired Luke Vossing.
When I was about 10 years old, I was in a car accident and I lost most of my small intestine. As a result of that, I have to have a feeding tube, and I used to have to get nutrition through an IV. The care that I received was so compassionate and caring and made that real strong impact on me, which made me go into nursing. I don't like to say that I chose nursing, it chose me, and it really became my life's calling. Mount Carmel is special because of the individualized care that they show to their students. You're not just a number at Mount Carmel, you're an actual student. They will stay and make sure that you receive all the information that you're supposed to. It really lays that really good base foundation of knowledge for then you to take on into your career.
Dr. Charles Sanders learned early on in life the important role that nurses play in the lives of both patients and physicians.
My mother was an OB nurse, and she was the one who directed me to a career in healthcare. And my mom all through medical school said, be nice to the nurses. The nurses will be your friend. The nurses will help you when no one else will help you. It's funny because she was right. When you're an intern and it's the middle of the night and you need some help, the nurse is at the bedside with you. The attending's not, he's at home sleep, and when you're in the ICU by yourself and the resident's not around, that ICU nurse is right there with you. Her advice was golden. The Mount Carmel nurses are amazing because they care. I can remember a situation where one of the elderly patients was coming to one of our clinics and she needed some assistance. Without any hesitation, the nurse asked, how can I help you? Versus just some people would just walk right by that individual, but she reached out and helped her to get to where she needed to be. Nursing can be tough because you're on the front line. You're taking care of a lot of people who have a lot of illnesses, both mental, physical, and spiritual. But remember that you were put here on this earth for a reason, and that was to help to heal the mental, the physical, and the spiritual.
For Joe and Nicole Long, the beginning of June meant their wedding was right around the corner. They were looking forward to celebrating with friends and family and enjoying their honeymoon in the Outer Banks. Those plans were about to change.
So it was June 2nd, which was a Thursday. We had just gotten home. We decided we wanted to go see a concert, which was on the OSU campus area. So we hopped on the back of the bike and just kind of cruising down back roads, and a car turned left, didn't see us, and turned right into the side of us.
2 days before our wedding.
2 days before our wedding. And initially get to the emergency room, and I knew my leg was broken, and it progressively got worse, especially for her. They do the x-rays, and you have a broken bone, and you have 2 broken bones, and we'll do the surgery tomorrow to reset you, and then we'll see. Got worse. We ended up in the hospital. I was there for 7 days. She was there for 8. Luckily, they got us in the same room after we spent one night apart.
We kept asking
down the hall.
each other.
We'd send messages through our parents down the hall and through the PCAs. And
Yeah.
we had just said that we still wanted to keep our wedding date the same as what we had intended. And the people who had come from Maine and California to be there for our wedding, let's just invite them to the hospital and see if we can make this happen.
The nurses totally went above and beyond and got us the chapel.
And decorated our wheelchairs.
It was just really, really touching that those nurses went through all that. And then one of the nurses came in on her day off of the day of the wedding to help us get down there. And then also got us, cake, meat and cheese tray. And also she got us sparkling grape juice. So it was just really touching, and it was really a good experience because of those nurses.
I think we had phenomenal care, not simply on a medical level, from the standpoint of checking our vitals, and we're making sure that we have the right meds and that we're doing the right things for our bodies and for healing and following doctors' instructions and things like that. Yeah, all of that was great, and I think we could have got that a lot of places. But what we received was on a much deeper level than that, like on a human experiential level. Just there was real empathy that was happening. Our staff really cared about us. So much so, again, that they did extra things for us that they didn't have to do. There's nothing about nursing that says you need to put signs on the back of wheelchairs that say Mr. and Mrs. and streamers and things like that all over them, and those type of things. But they cared about us. They cared about our story. They cared about who we were, just really on a deep emotional level.
More than just a job to them.
Yeah. Thank you so much for making our wedding happen, for helping heal our bodies, for giving us the opportunity to start life again as a couple, and making that process as painless, as pleasant, and as positive as it could have possibly been.
Yeah, I would say, thank you for being so positive and being there and, being like a family to us. And it meant the world to me. It may not mean the world to them, but it was my wedding day, and it really did mean a lot.